let me ask you something that no one probably ever has. When was the last time you actually took care of your penis? And no, I do not mean just cleaning it in the shower. I mean really caring for this part of your body the way you care for your heart or your joints. I'm Dr. Sarah, a urologist with over 20 years of experience helping men navigate these changes. And what I'm about to share comes from both real patient experience and solid science. For most men, especially after 50, penis health is ignored until it becomes a problem, but it doesn't have to be this way. Subscribe now, because this is a conversation every man deserves to hear, presented with honesty. In this video, I'll share a gentle, practical routine to support health and function. We'll discuss why this part of your body is a window into your circulation and the simple daily habits that make a real difference. The truth is, your penis is often the first place to show signs of poor circulation, long before your heart gives any warning. What you'll learn could quietly improve your confidence, vitality, and overall health. You know, in my 20 years working with men facing these changes, I've learned that understanding what's happening in your body is the first step toward feeling confident and in control again. Let me walk you through the science of what's actually occurring after 50, because knowledge truly is power when it comes to your health. As we age, 3 primary systems begin their natural evolution. Think of your circulatory system like a well-maintained network of rivers that have nourished your body for decades. Over time, these rivers may flow a bit less forcefully, and the channels themselves might become slightly less flexible. This isn't failure, it's simply the natural process of aging that affects every man. Your nervous system experiences its own gentle changes. The signals that travel from your brain to various parts of your body may take a moment longer to transmit their messages. Again, this is completely normal and expected. Finally, your hormone levels, particularly testosterone, begin their gradual, natural decline. This affects not just physical function, but also energy levels, mood, and overall vitality. Here's what I find fascinating from my clinical experience. The penis often serves as an early indicator of circulatory changes, sometimes years before your heart shows any signs of concern. The blood vessels in this area are smaller and more sensitive than those elsewhere in your body. When circulation begins to change, these smaller vessels respond first. Rather than viewing this as a problem, I encourage my patients to see it as a gift, an early warning system that allows you to take proactive steps for your overall cardiovascular health. Now, I want to address something many of my patients face. If you're managing blood pressure, diabetes, or cholesterol conditions that affect millions of men over 50, you may already know that certain medications can impact erectile function. This isn't something to be embarrassed about, and it's definitely not a reason to stop taking your prescribed medications. Instead, it's an important topic to discuss openly with your doctor. The beautiful thing about working with your healthcare team is that together you can explore ways to support your body's natural functions while maintaining your essential medical treatment. Let me share Robert's story. He's a 68-year-old retired accountant who came to see me while already working well with his cardiologist for mild hypertension. Robert had been married to his wife Helen for 42 years, and what he wanted was to feel more connected physically and emotionally in their relationship. I coordinated with his medical team, and together we added gentle daily walking and some simple dietary changes to support his circulation alongside his blood pressure medication. Within 8 weeks, Robert noticed he had more energy throughout the day and felt more confident in intimate moments. His cardiologist was pleased to see his blood pressure readings becoming more consistent. Today, Robert continues both his medical care and these natural approaches, feeling more vital and connected to Helen than he had in years. This brings us to our first pillar of support: circulation. Your cardiovascular system works like a sophisticated delivery network, bringing oxygen and nutrients to every cell in your body. The wonderful news is that you don't need to become a marathon runner to support this system effectively. Research from respected medical institutions supports gentle, consistent movement. A comprehensive analysis published in Geriatrics Journal in 2023 studied men and women over 60 and found that just 20 to 30 minutes of moderate walking, 3 to 5 times per week, produced statistically significant improvements in blood pressure and blood vessel function. These weren't young athletes, these were people just like you, taking simple steps to support their circulation. The study showed an average reduction of 7 points in systolic blood pressure and measurable improvements in how well small blood vessels responded to increased demand. This directly translates to better blood flow throughout your body, including to the sensitive areas we're discussing today. Beyond movement, nature offers us some remarkable allies. Research from Isfahan University of Medical Sciences examined pomegranate extract and its effects on inflammation markers in blood vessels. The study found that daily pomegranate supplementation helped reduce several inflammatory compounds that can affect vascular health. However, I always emphasize the importance of medical partnership here. If you're taking blood-thinning medications or blood pressure medications, pomegranate can potentially interact with these treatments. This is exactly the kind of conversation to have with your doctor. They want to know about everything you're considering for your health. Similarly, ginger has been studied for its effects on circulation. Research published by the National Center for Biotechnology Information found that ginger's antioxidant properties can support the health of the endothelium. That's the thin lining inside your blood vessels that helps regulate blood flow. Like pomegranate, ginger can interact with blood-thinning medications, so medical consultation is essential before adding it to your routine. What I love about these natural approaches is how they work with your body's own wisdom rather than against it. They support the systems you already have, encouraging your circulation to function as efficiently as possible. Our second pillar focuses on reconnecting with your body and mind. After decades of life's pressures, and perhaps some anxiety about physical changes, many men have become disconnected from their own physical awareness. The research here is particularly encouraging. A study from Harvard Medical School, published in the Journal of Sexual Medicine, examined mindfulness-based stress reduction in adults with an average age of 62. Participants who practiced simple mindfulness techniques for 8 weeks reported significant improvements in several areas: reduced perceived stress, increased self-compassion, and enhanced sexual function, including desire, arousal, and satisfaction. These improvements persisted even after researchers accounted for other health conditions. The practice doesn't need to be complicated. I often recommend to my patients that they spend just a few minutes each day focusing on their breathing, really feeling their body relax and release tension. Some find it helpful during a warm shower or bath. Others prefer those quiet moments before sleep. The key is consistency rather than duration. Sleep deserves special attention in our discussion. During sleep, your body performs its most important repair and restoration work. Hormone production, including testosterone, follows natural rhythms tied to quality sleep. A study published in Geriatrics Journal found that simple improvements to sleep hygiene, consistent bedtimes, limiting caffeine and alcohol in the evening, creating a relaxing pre-sleep routine, improved sleep quality scores by 25 to 30% within 8 weeks. Better sleep directly supports hormone balance, tissue repair, and overall energy levels. Many of my patients tell me that improving their sleep was one of the most noticeable changes they made, affecting not just physical function but mood and mental clarity as well. I want to speak directly to the partners who might be watching this. Your role is invaluable in this journey. Creating a safe, pressure-free environment for open conversation provides support that goes far beyond any medical intervention I can offer. The simple act of listening without judgment, showing patience and understanding, creates the emotional safety that allows physical intimacy to flourish naturally. Now, let me share a practical 15-minute daily routine that honors your body and supports all the systems we've discussed. I call it the self-respect protocol because it's really about treating yourself with the care and attention you deserve. Step 0, and this is the most important step, is scheduling a conversation with your doctor about everything we've discussed today. Share this information with them. Ask about potential interactions with your current medications, and get their perspective on which approaches might work best for your specific health picture. Step 1 takes about 10 minutes and focuses on movement. This could be a gentle walk after dinner, some stretching while watching television, or light calisthenics in your living room. The goal isn't intensity, it's consistency. You're encouraging blood flow throughout your entire body, supporting the delivery system that nourishes every cell. Step 2 requires just 3 minutes for mindfulness. Before bed, spend a few moments focusing on your breathing. Feel your body settling into relaxation. Some men prefer to do this during a warm shower, others during those quiet moments before sleep. You're reconnecting with your physical self and reducing the stress that can interfere with natural function. Step 3 takes 2 minutes for gentle self-care. This includes basic hygiene and perhaps incorporating those circulation-supporting foods. We discussed a small glass of pomegranate juice or adding fresh ginger to your tea after discussing these additions with your healthcare provider. The beauty of this routine lies in its simplicity and respect for your current lifestyle. You're not overhauling your entire life, you're making gentle adjustments that honor both your body's needs and your daily reality. What questions would you discuss with your doctor about adding natural circulation support to your routine? I'd love to hear what specific areas you'd like to explore further. Your questions help me create better content that serves our community's real needs. Let me address something I hear often in my practice: the concern that it's too late to make meaningful changes. In my experience, working with thousands of men over 50, I can tell you definitively that this simply isn't true. Your body has a remarkable capacity for positive response at any age. The circulation improvements we've discussed, the stress reduction benefits, the sleep quality enhancements, these begin working within weeks, not years. Frank, a 71-year-old retired firefighter, started with our simple walking routine at his doctor's recommendation. He was managing diabetes and initially worried that physical changes were inevitable and irreversible. Within 6 weeks of consistent, gentle exercise and better sleep habits, Frank reported feeling more energetic and confident. His glucose levels improved, and his relationship with his wife of 45 years took on new warmth and connection. The key insight here is that small, consistent actions compound over time. You don't need dramatic life changes to see meaningful improvements. You need sustainable habits that work with your current health management, not against it. I want to emphasize the collaborative nature of this approach. Everything we've discussed today works best when your healthcare team knows about it. Most doctors appreciate patients who take active interest in their overall wellness. They can help you navigate any potential interactions and often provide additional suggestions based on your specific health profile. For instance, if you're managing blood pressure, your doctor might recommend specific timing for that daily walk to maximize benefits. If you have joint concerns, they might suggest modifications to make movement more comfortable. This partnership approach ensures you're getting the safest, most effective support possible. The research I've shared today represents just a fraction of the growing body of evidence supporting natural approaches to men's health after 50. What excites me most about this research is how it validates what many men intuitively know, that their bodies want to function well and will respond positively to thoughtful care and attention. The circulation studies we discussed show measurable improvements in blood vessel function within weeks. The mindfulness research demonstrates reduced stress and enhanced connection with your body. The sleep studies reveal significant improvements in hormone balance and overall energy. These aren't theoretical possibilities, they're documented outcomes in men just like you. As we wrap up today's discussion, I want you to remember that caring for this aspect of your health isn't vanity or self-indulgence. It's comprehensive healthcare. It's listening to your body's messages and responding with wisdom and care. By supporting your circulation through gentle movement, managing stress through mindfulness, optimizing your sleep, and maintaining open communication with both your doctor and your partner, you're giving yourself the gift of vitality and connection. You're honoring the man you are today while creating the foundation for the man you want to be tomorrow. Your body has served you faithfully for decades. It deserves your attention, care, and respect. The approaches we've discussed today offer you practical ways to provide that care while working harmoniously with your medical treatment and lifestyle. If this information has provided value for you today, I hope you'll subscribe to our channel for more evidence-based men's health content that respects both natural approaches and medical expertise. Please share this with a friend or family member who might benefit from this perspective, someone who deserves to know that it's never too late to start caring for himself with intention and hope. Thank you for taking this time to invest in your health and well-being. Remember, your best self isn't behind you, it's the one you're actively creating through thoughtful choices and self-respect, starting today.